All right, guys, so I'm going to be continuing with chapter 10. This is a continuation of part A, but what I'm going to be doing is I'm going to be calling this part B. What ended up happening is because I started using the 3D, the ANP from the Netter's 3D website. Well, that lecture ended up getting way too long, so it was over 2 hours. So what I did is that I broke it up into that I'm breaking it up now into a part A and a part B. So I think originally this muscular system is into three parts, part A, B, and C. So what I'll do is now I guess it's going to be a part A, B, C, and D. The other thing is let me know in the comments below or send me a message out um, if you want me to continue using the 3D uh, atlas. Let me know and I'll do that. If you don't want me to do that, if you just want me to go with the books, then that's fine. Also, I'll do that also. So based on the comments that I get from you guys, I'll adjust the future lectures for chapter 10 accordingly. Because what's going to end up happening is if I end up using the 3D atlas, the lectures are going to be much, much, much longer, just like this one is. So let me know, and based on your feedback, I'll create it accordingly. All right, so let's move ahead now. Now we're going to be looking at the muscles that are involved in biting and chewing. Now the term that we use for chewing is mastication. And there's four pairs of muscles that are involved in mastication. And all these muscles, they're innervated by the mandibular branch of cranial nerve number 5. And this is referred to as the trigeminal nerve. The prime movers of jaw closure and biting are the masseter and the temporalis muscles. Now you can feel this pretty easily. So when you bite your teeth or when you clench your teeth really hard, feel on the side of your cheeks, and that muscle that's protruding out, that's your masseter. And then if you go upwards towards where your temples are, you'll be able to feel your temporalis muscles as well. Side to side grinding movements, they're brought about by the pterygoid muscles. Now, the buccinator muscle, it also plays a role in chewing. Normally, gravity is more than enough to depress the mandible, but if there is resistance to the jaw from opening, then your neck muscles, such as the digastric and mylohyoid muscles, are activated. We're also going to be looking at the extrinsic tongue muscles, and these are the muscles that anchor and move your tongue. Now, all the extrinsic tongue muscles, they're all innervated by cranial nerve number 10, which is referred to as, which is also known as the hypoglossal nerve. And these three are the genioglossus, hyoglossus, and the styloglossus. So now let's look at these muscles in detail. So the first thing that we're going to be looking at is this masseter muscle. Okay, and this is the prime mover for your jaw when it closes. So this is a prime mover of jaw closure. It also elevates your mandible. But the main movement, the prime movement, is it's for jaw closing. And its insertion is the angle of the ramus of your mandible. And the origin, it's right over here. This is going to be the the zygomatic arch and the zygomatic bone right over there. And yeah, this is also, it's innervated by the trigeminal nerve, which is cranial number 5. So the four muscles that we're going to be looking at, they're all innervated by cranial nerve number 5, your trigeminal nerve. The next muscle that we're going to be looking at is this muscle right here, this fan-shaped muscle, your temporalis, and it overlies this temporal fossa that's there, and yeah, it's makes part of your temporal, frontal, and parietal bones. So the origin for this, the temporalis muscle, is the temporal fossa, and its main movement is jaw closure. Okay, so it closes the jaw. It elevates and retracts the mandible as well, and it maintains position of the mandible at rest. Deep anterior part, it may help protract the mandible also. So right over here, this part over here, this can help protract your mandible. And next thing we're going to be looking at, I don't know if you can see it here. No, we can't really see it here. Is your medial pterygoid muscle. So let's see if this, well, over here you can't see it either here. I'm going to try to find you guys a better picture where you can see your medial and lateral pterygoid muscles. But so let's talk about this since we're over here anyway. So the medial pterygoid, now these are a deep two-headed, biheaded muscle that runs along the internal surface of the mandible and is largely concealed by the mandible. Now the insertion is the medial surface of the mandible near its angle, so it's going to be inserting somewhere right around there, and unfortunately you cannot see it. Um, Again, this is why it's very important to, if you guys have models that you can work with, it's very important to work with models so you can see it better. Also, if you have an atlas, please refer to an atlas, a picture atlas, where they show you these muscles clearly. Um, so, yes, back to this medial pterygoid. So the insertion is the medial surface of the mandible near its angle. So again, like I said, it's going to be over here somewhere. And the origin is going to be the medial surface of the lateral pterygoid plate of your sphenoid bone, the maxilla and the palatine bone. Um, Again, it's very difficult to see. You cannot see it here. And then the lateral pterygoid, again, this is also a deep two-headed muscle. It lies superior to the medial pterygoid muscles. And the insertion for the lateral pterygoid muscle is the condyle of the mandible and capsule of the temporal mandibular joint. And the origin is the greater wing and lateral pterygoid plate of your sphenoid bone. And now, as far as the movements go, let's just go back to the first one, the medial pterygoid. It acts with the lateral pterygoid muscles to protrude the mandible and to promote side-to-side grinding. And again, for the lateral pterygoid, it provides forward sliding and side-to-side grinding movements of the lower teeth. Then we can look at, let me see, I think we had it over here, this muscle here. There we go, the buccinator. Now, the buccinator muscle, uh, this compresses the cheek. So I think we spoke about this a few slides ago. But yeah, this is so when you kind of suck in, this is the muscle that's doing that. Okay, this buccinator muscle. It helps keep keep the food between the grinding surface of your teeth during chewing. Now we're going to be looking at those three extrinsic muscles of your tongue. So the first thing we're going to be looking at is this the genioglossus muscle right over here. And this is a fan-shaped muscle. It forms the bulk of your inferior part of your tongue. Its attachment to the mandible, it prevents the tongue from falling back into your throat. So you, you don't die from suffocation. So there's no obstruction in your respiratory tract. The insertion is the inferior aspect of the tongue and the body of the hyoid bone. So here's the hyoid bone right over here. So this is where it's attaching to. And the origin is the internal surface of the mandible near the symphysis. So you can see, uh, it's hard to see. So this is the origin right over here, okay? And again, you can see the insertion. Well, you can't really see the insertion because of these other muscles that are in the way. Which brings us to this muscle over here that's obstructing it. Is this hyoglossus, not glossal, hyoglossus muscle. Now the hyoglossus, this is a flat quadrilateral muscle. You can see it. It's flat quadrilateral muscle. And its insertion is inferior lateral, the inferior lateral tongue. Okay, you can see that. You can't really see it here. The infralateral tongue is the insertion right over here. Okay, to the side and underneath infralateral, and the origin is the body and greater horn of the hyoid bone. So again, uh, it's going to be this area over here, the horn and the body and the horn. Um, let's see. We'll see if we can get a better look at this. But this hyoid bone, again, this is kind of it's not this is another bone in the body that's not it's floating. It's not attached to any other bone. It doesn't work with. This is the only bone actually that floats in your body. It doesn't articulate with any other bone. The scapula, we said it's floating also. It's not anchored onto anything. It's also anchored by muscles. But the scapula does articulate with um, your humerus. This bone here, this hyoid bone, this doesn't articulate with any other bone. It's the only bone that does that I'm aware of. Also, just so you guys know, CSI type of thing. Um, this, if somebody's uh, died, when somebody's found dead, one of the things that the examiner is going to look at is this bone to see if there's strangulation. So when they look at this bone, and if it's been fractured, then you know that the victim may have been strangulated. So usually when strangulation occurs, um, this bone will fracture, and again, it could be the cause of death. It may be one of the causes of death. It could be more. And then we're going to be looking at your styloglossus muscle. Okay, so this is a styloglossus muscle right over here, and it attaches to this bone over here. This is the styloid process. Again, you can't see it because the muscles are in the way and the tendons that are attaching to it, but this is the styloglossus muscle right over there. Uh, And this muscle here that goes from the stylo process to the hyoid bone is the stylohyoid, but we're not going to be looking at that right now. We're going to be looking at the styloglossus. So it's a, as you can see, it's a pretty thin muscle, it's slender muscle. It runs superiorly to and at a right angle to this hyoglossus muscle. And its insertion is the inferior lateral tongue, and here, inferior lateral tongue. And the origin is the styloid process of your temporal bone. So right over here, it's the styloid process of the temporal bone. And yeah, that's its origin and insertion. So let's see if we can find some more pictures to look at. All right, so be sure you guys go and view these animations that we have either at the Pearson website, you can search for it on YouTube, or go to your book came with the DVD. So there's one, two, there's three. There's one on the buccinator, masseter, and the temporalis muscles. So please be sure to view these. So I'm going to be using both this netters, this 3D netters, the online, as well as I'm going to be using this other website that we have that's called Zygote Body. But let me start over here, and then we'll, as I need to, I'll go to the other one. I'll kind of flip flop. This is the first time I'm using actually. Actually, the second time I'm using this, and the first time I'm using this Zygote Body. So I'm not good at either one of these. So please excuse me my lack of proficiency um, in these softwares. But let's look at this muscle that we looked at, this temporalis. So remember the left temporalis muscle. Now the good thing about this Netters 3D, it lets you know the right and left side of your body. So again, this is temporalis, this is the left temporalis muscle. Now if you remember temporalis, this is the muscle that it helps close your jaw. It also elevates and retracts the mandible. It maintains the position of the mandible at rest. And the masseter, the temporalis, and then the pterygoid muscles, keep in mind they're all innervated by the trigeminal nerve, which is cranial nerve number 5. But back to this temporalis muscle. The insertion is going to be the coronoid process of your mandible, and then the origin is going to be the temporal fossa. So the temporal fossa is right around over here. And we might be able to see it in the zygote body. But again, this is this fan-shaped muscle, this temporalis. And then at the same time, before we go there, let's just talk about this also, this masseter muscle. So the masseter muscle, again, this is the prime mover of your jaw to close it, for prime mover of jaw closure. It also elevates your mandible. Now, its insertion is the angle and ramus of the mandible, and the origin is the zygomatic arch and your zygomatic bone. So you cannot see it, but what I'm going to do is this. I'm just going to, actually, I won't do it now. I'll do it a little bit later. But let's go over here and let's look at those these things that we just spoke about. So the good thing about this zygote body is I can kind of, hide the bone and then, make the bone appear and try to make it transparent, which is, I haven't figured out quite how to do that. Uh, but so here again, this is your temporalis muscle over here, okay? And remember, this temporalis muscle, it closes your jaw, and it's one of the muscles that help close the jaw, and remember, it elevates and retracts your mandible. And I'm gonna get rid of that, so you can see where it was that temporalis muscle. This is that temporal fossa that we're talking about. So it's that's where its origin is going to be. Um, and when we talk about the insertion, now how do I get it back? There we go. I got it back. So remember, the insertion for this the temporalis muscle, it's going to be the coronoid process of your mandible by a tendon. Now remember, how can we look at this coronoid process? Well, first let's get this out of the way. This is your well, zygomatic bone over here. Got that out of the way. Let's get these muscles out of the way as well. We don't need to see any of these. Get this muscle out of the way too, might as well. Now, here we go. You can see this is the coronoid process of your mandible, and when I move it around, you can see how it attaches to right over there. Okay, so this is that bone, this is that coronoid process, and this is where this temporalis muscle, it attaches to by this tendon. Okay, so now you can see the insertion point for this muscle. Now let's look at the this masseter. So this is the other muscle, okay, that you use when you're eating, when you're chewing food. Um, so this masseter, now its insertion is going to be at the angle and the ramus of the mandible, and the origin is going to be the zygomatic arch and the zygomatic bone. Well, I just got rid of the zygomatic bone, so you're not going to be able to see it. But here, let me see if can I. There you go. I brought it back up. So you can see how it's attaches over here to the zygomatic arch over here. Okay, of the zygomatic bone. And then what we're going to see is, if you can see over here, that where it inserts into the mandible right over here. Okay, uh, there. See the insertion over here onto the mandible, and for this masseter, so this is the angle and ramus of the mandible right over here. So this is the angle right over there. You guys see the angle there. This is the ramus of the mandible, and that's his insertion. Now let's get rid of this. Okay, so we can see some other stuff. That's these muscles are covering. Okay, and I think I got rid of some things that I didn't want to get rid of. There, move that out of the way. And this is the deep masseter. I can get rid of that. Now, the other thing that we wanted to look at is, so we looked at that. Let's go ahead and now look at your medial and your pterygoid. Okay, your medial and lateral pterygoid. So let's look over here. All right, so I'm gonna move this out of the way again, over here. Uh, there, move that out of the way, move this out of the way. I'm gonna move this platysma out of the way. This is the sternocleidomastoid. You can move that out of the way also. Move that out of the way. This is the masseters. Move this out of the way. It's also part of your masseter. And now we have, okay, the medial pterygoid. You can see over here, and you have your lateral pterygoid. So now, all right, we can't see the insertion points, but remember these pterygoid muscles, they work together, and they act with the so the medial pterygoid, it works with the lateral pterygoid muscle to protrude or protract your mandible and to promote side to side grinding movement. And there's the synergist of your temporalis and masseter muscles in the elevation of the mandible. So now for the medial pterygoid, okay, um, over here, it's going to insert, your medial pterygoid was going to insert into the surface, the medial surface of the mandible near its angle. Now, if you go back over here and let's see if you can see it. I'm going to get this out of the way. Okay, get that out of the way and get that out of the way. And these are the nerves. I'm going to hide the nerves. I don't want to see the nerves. There we go. Okay. And right over here, so this is this external pterygoid. Uh, so this is going to be your lateral pterygoid. So now the lateral pterygoid, um, it's going to insert into the condyle of the mandible. So the condyle, if you guys, here, the condyle of the mandible, notice, so this is the mandibles, if you can see, this is the mandible over here. It's transparent. So notice where it's coming and inserting itself into. So this is the condyle, okay, in the inner part, okay, and it's inserting, um, yeah, the condyle of the mandible and the capsule of the temporomandibular joint. That's where it's going to come and insert at this lateral pterygoid, and the medial pterygoid. So one second, hold on. I think I said this wrong. Let me go over here. So this is it. This is the medial pterygoid, right? Yeah. So the external, the medial pterygoid, right? It's okay. So yeah, I said it wrong. So the external and the medial pterygoid, they're one of the kind. The external and the medial pterygoid, they're the same. Uh, Now, this external pterygoid, or this medial pterygoid, it's going to insert at the medial surface of the mandible. So here's the medial surface of the mandible, and near its angle. So the angle is right over there. If you go back over there, you can see where it kind of, it's going to come in. The angle's right over there. So you can see it inserting right over. So there you go. You can see the outline of it. It's going to come and insert itself right over here. So this is where this medial uh, pterygoid will come and insert here at the medial surface of the mandible near its angle. And the origin is going to be the medial surface of the lateral pterygoid of your sphenoid and maxilla. Now, can we see that? That's going to be much more difficult to see, the origin. So if we go this way, and we start taking things away, I don't think that's going to happen. But let's give it a shot anyways. Let's move this out of the way. Let's move that out of the way. Move this out of the way. Move this, move that. Move that out of the way. And yeah, okay, I don't know how to do that. I'm sorry, guys. I can't show you the origin for it. But here goes your inner ear bones, though. Your middle ear bones, not inner, middle ear bones. And okay, so I apologize for that. I cannot show you that to you. But here, we're gonna move this out of the way then. And so since we look at the medial pterygoid, now let's look at the lateral pterygoid. So remember, the the pterygoid is going to insert at the condyle of the mandible. So the condyle is up over here. Okay, and let's see. So here we go. This is your medial, your lateral pterygoid. Sorry, your lateral pterygoid. Notice it's coming over here, and it inserts. Oh, sorry. There we go. Now you can see it. So right over here. So this is your medial pterygoid, and this is the lateral pterygoid. So the lateral pterygoid is inserting over here at the condyle of your mandible, and its origin is going to be the medial surface of the, well, you cannot see the origin, unfortunately, again, but yeah, you can't see it, but you'd have your sphenoid bone over here. So um, so now we looked at the lateral pterygoid, the medial pterygoid, the temporalis, and the masseter. We look at the insertions. I just want to get rid of this out of the way. Now let's go to the your tongue muscles. But before we do that, let's see what else is there. This is that buccinator muscle. Now remember, this is the muscle that you use to suck in your cheeks, again, for when infants use this during nursing or when you're whistling. So it's that buccinator. And this is remember, this muscle, it gets innervated by cranial nerve number 7, your facial nerve. So let's move that out of the way. I can move this out of the way. I don't want to see the teeth. So I'll get rid of all these teeth over here. I want to keep that there. Um, get rid of that. Oh, get rid of that. And get rid of that. Get rid of that. There we go. I think this is better. I want to get rid of the mandible also. Okay, there. Get rid of the mandible. Let me get rid of these guys here, the pterygoid muscles. Bye-bye. Goodbye. Goodbye. Unfortunately, I got rid of the styloid process also. And yeah, I got rid of the styloid process because I got rid of the temporal bone. Okay, so now what we're going to be looking at is this. So your styloid process would be right over here. Okay, this is where your styloid process would be. And this over here, this is your styloglossus muscle. This is one of the muscles of your tongue. This muscle here, it retracts your tongue. So again, its origin is the styloid process of the temporal bone, and it inserts into the inferior lateral tongue. So now let's look at the tongue over here. So this is the genioglossus muscle. Now remember, this forms uh, the bulk of the inferior part of your tongue. Okay, that's genioglossus muscle. And where does this insert to? The genioglossus. It is inserts into the inferior aspect of the tongue and the body of the hyoid bone. So now let's look at the hyoid bone and how we're going to look at that. If You can see the hyoid bone. Now, the cool thing about the hyoid bone is this is the only bone in your body that floats. That's not articulating with any other bone at all. So it's held in place purely by muscles. Um, Now we know we said that about the scapula, but remember the scapula it actually articulates with your humerus. This hyoid bone doesn't articulate anything at all. And if you work for the coroner, and again you're a pathologist, one of the things that you do is a CSI moment or a Dexter moment, guys. Um, they check to see this bone. If it's fractured, that means the victim was strangled to death. So this bone it breaks when you strangle somebody. And here, let me get here. I can get rid of this out of the way. I don't want to see you. I don't want to see you. And now this computer froze because connection is lost. There we go. There we go. And here, now you can see the hyoid bone. So there we go. This is the hyoid bone right over there. So you can see it's kind of like this U-shaped, or some people say it's a horseshoe-shaped bone. Um, so over here, again, you can see right over here. This is this mylohyoid. We're going to get rid of that. But it's a little bit difficult to see what I'm trying to show you. There, got rid of that out of the way also. Why is this back? This came back. I didn't want this. I didn't want this. I didn't want this. Get rid of the buccinators. There, I got rid of the jaw also. There we go. So now we can see there, all those things came back for some reason. So this over here, this is going to be your styloglossus, and I told you about this already. So I'm not going to get rid of that because we're going to need it. But this is his genioglossus. So, but what I would do want you to notice is look at how this inserts. Okay, so this styloglossus is going to come and again it inserts to the inferior lateral tongue. So it's the inferior and the lateral aspect of your tongue over here. This is where it's going to insert to. And remember, its origin is going to be the styloid process. And so we're talking about the genioglossus, and it's going to insert at this hyoid bone, the body of the hyoid bone. And if you look over here, let me here try it like this. Pin this. There you go. Oh, perfect. It's gonna. So here you can see the hyoid bone over here, and notice what it's doing. It's actually pinning the insertion point of this of that muscle of the genioglossus. But it's difficult to see. So if you kind of move this along the way, let me try to move some of these things out of the way so you can see it better. So I'm gonna move this digastric muscle out of the way, and there. Now you can see it. There you go. See, now it's the perfect. Now you can see it. Not perfect, but here, much better than before. Now you can see right over here how it's where it interacts with the hyoid bone right over there. And then the same for the hyoglossus. Now you can see both how the hyoglossus, which we didn't talk about yet, but this hyoglossus it inserts at the inferior lateral aspect of the tongue also. So if you look over here, you have your, let me pin these strings here, and then I'll pin this guy here also, your styloglossus. So now you can see these three muscles. So notice both the hyoglossus and the styloglossus, it's going to insert to the lateral surfaces, to the lateral aspect of the tongue. And so the hyoglossus, this is gonna it's gonna end up depressing the tongue, okay, and it draws it towards its side downwards. Uh, the styloglossus, we said it retracts and it elevates the tongue, and the genioglossus it protracts the tongue. Okay, it can depress or act in concert with your extrinsic muscles to retract the tongue as well. And all three of these nerves, your styloglossus, hyoglossus, and the genioglossus, they're innervated by your hypoglossal nerve, or that's a cranial nerve number 12. When you guys get to the next to the chapter in the nervous system, you're gonna have to memorize these cranial nerves. So don't forget them. Keep these in mind, okay? Your cranial nerves. Um, so remember, cranial nerves number 12. They innervate your tongue muscles, right? And I think that's it for now. But let's go back over here and let's look at it over here as well. So I'm gonna move these pterygoids out of the way, and this way you guys can see it, have another aspect, another perspective to look at of these muscles. So those are the pterygoid, your the medial, and your lateral. So pterygoid muscles. So this is the lateral, this is the medial, and then we have, move this out of the way, move that out of the way, get these out of the way. Rhizoras out of the way, and this guy out of the way. And so here, this is the left styloglossus, and then we have your, can get this out of the way. Can also probably get this out of the way. Maybe we should have left it there. Anyways, here, this is your genioglossus muscle there, your styloglossus, and now we're going to be looking for this hyoglossus muscle. So get this out of the way, and there we go. Hyoglossus muscle is right over there. Okay, so hyoglossus, styloglossus, and the genioglossus muscles. And if you look around, here's another view of it: genioglossus, styloglossus, and we move this out of the way. Turn this back to see the hyoglossus muscle. Okay, there we go. Hyoglossus muscle. So no, notice over here, hyoglossus muscle attaching there. Styloglossus will attach here, and then you have your genioglossus, and that's it. Now we're going to be looking at muscles of your anterior neck and throat, these swallowing muscles. So the neck, it ends up getting divided into two triangles, anterior and posterior, by the sternocleidomastoid muscle. And what we're going to be looking at are the muscles of the anterior triangle. And these anterior triangle muscles, they end up getting further divided into suprahyoid and infrahyoid muscles. And these are muscles being either above and below the hyoid bone. Now, most of these muscles, these are throat muscles that are involved in swallowing. Now, swallowing, it starts when the tongue and buccinator muscles of your cheek, they squeeze the food back along the roof of the mouth and towards the pharynx. Remember, the pharynx is just another name for your throat. Then a rapid series of muscular movements in the posterior mouth and pharynx, it completes the process. The events of swallowing, they include the following. The very first thing is the suprahyoid muscles, they pull the hyoid bone upwards and forwards towards the mandible. Now what this does is that it widens the pharynx to receive the food. Now since the hyoid bone is attached by the thyrohyoid membrane to the larynx is also pulled upwards and forward under the cover of the flap-like epiglottis. Now what this does, it closes off the respiratory passageway. Now remember, the larynx, this is the gateway. This is uh, the entry point for air to enter your lungs. Okay, and this epiglottis, this is a flap of tissue that covers this larynx when you swallow food. So you don't want food going down into your lungs. Okay, because if that happens, then you're going to choke, because at that point the food is going to be it's going to prevent air from getting into your lungs. So that's not good. We don't want that. The other place where you don't want food going to is in your nasal passages. So small muscles that elevate the soft palate, they close off the nasal passages to prevent the food from entering your superior nasal cavity. Now these are the tensor and levator valli palatini muscles. They don't talk about them. I don't think they talk about it in your book, but if you go online, you should be able to find them. And also, you might see pictures of them in your book. Next, what happens is the food it gets propelled through the pharynx into the esophagus inferiorly by muscles in the walls of your pharynx. Now, these are the pharyngeal constrictor muscles. Finally, the infrahyoid muscles, it returns the hyoid bone and your larynx to their more inferior position as swallowing ends. Now let's look at these suprahyoid muscles. So there's the four deep muscles that are involved in swallowing. These are the muscles that move the hyoid bone and larynx. They form the floor of the oral cavity. They anchor the tongue. They elevate the hyoid bone and they move the larynx during swallowing. And these are the digastric, stylohyoid, mylohyoid, and the geniohyoid muscles. And the infrahyoid muscles, these are four strap-like muscles that depress the hyoid bone and larynx during swallowing and speaking. Take two. And the infrahyoid muscles, and the four strap-like infrahyoid muscles, uh, and the four strap-like infrahyoid muscles that depress the hyoid bone and larynx during swallowing and speaking are the sternohyoid, sternothyroid, the omohyoid, and the thyrohyoid muscles. And we're going to be looking at all these four in the next few slides to come. Now, we're actually going to be looking at all eight muscles that we talk about, actually, not just the four. So we'll start off over here with these suprahyoid muscles, and then we'll probably go into the infrahyoid muscles, unless they give some more pictures in the next slide of suprahyoid muscles. So depending on order of the slides, we may end up going back and forth. So the first thing we can look at is the digastric muscle. So notice this digastric muscle. It's this V-shaped muscle that you see over here. So it's made up of two bellies, this anterior belly and this posterior belly, and it's connected by this intermediate tendon that we see over here. So again, you have this is V-shaped muscle that we have under the chin. Now it opens the mouth and it depresses the mandible. So acting in concert, this digastric muscle elevates the hyoid bone and keeps it steady during swallowing and speech. The insertion is by a connective tissue loop to the hyoid bone. This is your hyoid bone here over here, and you can see this connective tissue over here that's inserts it to this hyoid bone right over there. And then the origin is going to be the lower margin of the mandible. Okay, and this is the anterior belly. So this is the lower margin of the mandible, and the masseter process of the temporal bone, which it's difficult to see. You cannot really see it over here, but for the posterior belly, its origin is going to be the masseter process, and we might be able to see it in the other in the 3D atlas that we look at. So let's see what else could we see over here. So over here you have the stylohyoid again. So it's cut off. So what you see over here is this the insertion into the hyoid bone, but what you don't see is the where it goes and attaches to the styloid process. So again, the insertion is the hyoid bone, and the origin is going to be the styloid process of your temporal bone. So again, it's a slender muscle. Again, that's below the angle of your jaw, and it elevates and retracts your hyoid. So what it does is it elongates the floor of the mouth during swallowing. It's innervated by the facial nerve, and let's see if you can see it over here. So here, over here, yeah, you can see it here. This is this stylohyoid muscle over here. The next muscle that we can see is this big one here, this mylohyoid muscle. So its origin is going to be this medial surface of the mandible, and then it inserts into the hyoid bone. And also, so it inserts to the hyoid bone, and this part right here, this is this median raphe. It's a strip of connective tissue. And what this mylohyoid bone does is it elevates the hyoid bone and the floor of the mouth. This enables the tongue to exert backward and upward pressure that forces food into the pharynx. Now, the other thing that I wanted to mention to you is when you take food and you start chewing it, it's no longer called food. It's called a bolus. And you learn this term when you get to the chapter in the digestive system. But keep this in mind. When food is placed into your mouth and you start chewing it, it's called a bolus. So again, if you see this term again, you know what's being referred to. So the mylohyoid, it's being innervated by the mandibular branch of your trigeminal nerve. I think I forgot to mention to you for the digastric, the nerves that innervate it. So uh, cranial nerve 5, again, the trigeminal nerve, it what innervates the anterior belly, and for the posterior belly, it's innervated by your facial nerve, cranial nerve number 7. The geniohyoid muscle, it runs from the chin to the hyoid bone deep to the mylohyoid muscle. So it inserts into the hyoid bone, and its origin is the inner surface of the mandibular symphysis. So you can't see that inner surface of the mandibular symphysis here, but you can see this geniohyoid muscle, and you can see it inserting into the this hyoid bone right over here. So its action is that it pulls the hyoid bone superiorly and anteriorly, and what this does is it shortens the floor of the mouth and it widens the pharynx for receiving food. It's as far as this nerve supply, it's the first cervical spinal nerve via the hypoglossal nerve. That's your cranial nerve number 12. Now we're going to be moving on to the infrahyoid muscles. So the first one we're going to be looking at is the sternohyoid, and as the name implies, we're going to be looking at a muscle that goes from the sternum to the hyoid. So the insertion is going to be the lower margin of the hyoid bone, and the origin is going to be the manubrium and the medial end of the clavicle. So here's this is the muscle right here, the sternohyoid bone, and you can see it inserting over here into the hyoid over here. Again, this is the lower margin of the hyoid, and then now we're going to see it. If you can follow it, we can't really follow it, but you can see a little bit over here where it inserts into, well, actually, where the origin is at this the medial end of this clavicle here. It's the medial end of the clavicle and the manubrium. Uh, the next, oh, okay. So what does this muscle do? So it depresses the larynx and the hyoid bone if the mandible is fixed. So it may also flex the skull. Now, as far as the nervous supply, cervical spinal nerves 1 through 3, so C1, C2, C3, through the ansa cervicalis. And again, this is a slender nerve root in the cervical plexus. Now, we talked about the movement for this also. So now we can move on to the next muscle, which let's see. So we looked at this sternohyoid. By the way, this is a sternocleidomastoid. Um, so this name, okay, so this muscle is going to connect to the sternum. Uh, you can't really see it, but yeah, it attaches to the masseter process, and then you see it over here. It's going to the sternum, and then it's also going to go to the clavicle. So you see over here, this is then it goes to the clavicle, and this goes to the sternum, and this goes to the mastoid. So you have a sternocleidomastoid. And we'll look at this muscle a little bit later. But the next thing we want to look at is this. Let's look at the sternothyroid instead. So here we go, right here. This is the sternothyroid muscle, and it's a lateral. It runs lateral and deep to the sternohyoid. So there you go, right over here. So we saw the sternohyoid, and this is going to be lateral to it, and it's going to be deep. Okay. So now, by the way, this is your thyroid gland right over here. So just keep this in mind. So when we're talking about sternothyroid, one of the reasons why we're referring to it is because of the cartilage that's over here. So anyway, sternothyroid, let's look at this now. Uh, its insertion is going to be the thyroid cartilage. Okay, so right over here is this thyroid cartilage. That's where it's inserting into uh, this for this muscle, sternothyroid. And then its origin is going to be the posterior surface of the manubrium and sternum. So here's this uh, the manubrium over here of your sternum. So your origin is right over here. And then the insertion, if you follow this along, you're going to see it at the thyroid cartilage. And right over here is your thyroid cartilage. Your thyroid gland is over here, and the thyroid cartilage is up over here. So this is where it's gonna be inserting into, right over here. And then you have the next muscle. Well, let's finish up with this before moving on to the next one. I was gonna go to the thyrohyoid, but let's just finish the sternothyroid. So what this muscle does is that it pulls the larynx and hyoid bone inferiorly. Uh, Next, we can look at and as far as the nerve, the nerve that innervates it, it's the same as the sternohyoid, C1 through C3. Um, so for the sternohyoid, the sternothyroid, and the omohyoid, they're all C1 through C3. These the cervical spinal nerves. So now that we looked at the sternothyroid and the sternohyoid. Now let's look at the omohyoid. Okay, so the omohyoid, it's right over here, and we don't have another view of it. Okay, because it gets covered by the sternocleidomastoid. So the omohyoid, you can see the superior belly of it. Um, so it's a strap-like muscle. It has two bellies. It's united by an intermediate tendon, um, and it's lateral to the sternohyoid. So again, this is your sternohyoid, and it's lateral to it. Now, its origin is going to be the hyoid bone and the lower border of it, and I'm sorry, its insertion is going to be the hyoid bone, the lower border of the hyoid bone, and its origin is going to be the superior surface of the scapula. So you're not going to get to see that here. I'll try to show it to you in the 3D model. And again, what does this muscle do? It depresses and retracts your hyoid bone. Okay, it depresses and retracts the hyoid bone. Lastly, we have the thyrohyoid bone. And here we go. This is right over here, the thyrohyoid bone. And this thyrohyoid bone, um, it inserts at the thyroid cartilage, okay, which is right over there. This is the insertion, thyroid cartilage, thyrohyoid, and it's going to go to the hyoid bone. This is uh, I'm sorry, yeah, the insertion is going to be the hyoid bone, and the origin is going to be the thyroid cartilage. Okay, I'm sorry, I said it backwards. So once again, let me clarify this. The thyrohyoid, the origin is the thyroid cartilage, and the insertion is the hyoid bone. Okay, and for its nerve supply, it's the first cervical nerve via the hypoglossal nerve. And here's a cadaver. You guys can look at this also if you have an atlas. So you can see the sternohyoid over here. This is the sternocleidomastoid you can see here. And they cut off the platysma muscle here, so you can see these, which is exposed. Uh, this is your, again, that's part of your mylohyoid over here. And what else do we have? You can see the omohyoid over here, the superior belly of the omohyoid. Again, the sternohyoid. Um, what else? Okay, we looked at this already. Now be sure you look at this animation again. Go to the website, look on YouTube, or if you book him with the DVD, look at that. And again, you have another one. Please be sure you look at this as well. Here I am I'm starting out with the zygote now. So when you look over here, here's that V-shaped muscle that you see underneath the chin, which is this digastric muscle. So remember, this digastric, the insertion is going to be at again, it's right over here, this connective tissue over here uh, uh, that connects to the hyoid, which you cannot see over here. But the hyoid bone should be right. Let me see, hold on, if I can show the hyoid. Oh, yeah, now I can show the hyoid. But all this other stuff comes here as well. So here, I got rid of that. So here, yeah, this is where the insertion is going to be over here. Um, over here to the hyoid bone over here. Um, and the origin is going to be lower margin of the mandible, and I just got rid of that. I'm not going to make it come back up. So we already discussed that. I just wanted to give you guys another view of this muscle. Okay, so this is the digastric. Now let's look at the stylohyoid. So over here, again, I'm going to remove this platysma out of the way, and I want to leave that bone over there so you have something to look at for a reference. So right over here is this stylohyoid muscle. Okay, this is your stylohyoid right over here. Notice it's connecting over here to the hyoid, and then it goes up to the styloid. See, the origin is the styloid process, and the insertion is going to be your hyoid bone, and this is what elevates and retracts your hyoid bone. So we got this out of the way, stylohyoid. Now I'm going to close these off as we go through, just so I know, keep track of what we looked at and what we've done, what we haven't. So we looked at this, we looked at that. Uh, Again, this is another view of the digastric. I'm going to close that out. Uh, and then let's see, now we can look at this, the mylohyoid. So if I click over here, nothing happens. And let's get this out of the way. Let's get this out of the way. I want to move this out of the way also. And let's see. Um, no. Oh, here. Well, this is the omohyoid. So let's just go to the omohyoid then, I guess. So the omohyoid, remember, it inserts into the hyoid bone, which is what we're looking at up here. This is the insertion at the hyoid bone. And the origin is going to be the superior surface of the scapula. So if we follow this bone here, notice how long this bone is. So it goes all the way from up here and it runs all the way down. And there it goes. It attaches itself to the scapula over there. Okay, there, you can see it better over here. There it is, right over there. So this is omohyoid. Notice how long this thing is. Okay, it's huge strap-like bones. This is omohyoid bone, and this depresses and retracts your hyoid bone. Um, Now I'm gonna get rid of this omohyoid bone. I can get this out of the way. Perfect. And let's see. Uh, well, here, sternohyoid. Might as well look at this since we're looking at this. Um, Wait, what are we looking at? Sternohyoid, sternothyroid. Okay. So this is the sternohyoid that we're looking at now, the sternohyoid. And if you look over here, this is, yeah, this over here. So this is the origin over here for the sternohyoid. So the manubrium and the medial end of the clavicle, right over there, you can see, and that's the medial end of the clavicle over there, and you can see that. Well, very difficult to see the manubrium. Let me see if I can. No, it doesn't make much of a difference at this point. So I'll just leave it at that. So yeah, this is where you're going to have your sternohyoid over here. Um, and this is going to depress your larynx and hyoid bone. So let's follow this up. So we saw this over here at the sternum, and then let's look at it go up to the hyoid, and okay, right over there, it keeps going up, and it's going to attach itself over there. And so let's get that out of the way. Sternohyoid bone. Did you get that? There we go. Sternohyoid. We can get rid of this now. Now let's look at this. That's a sternocleidomastoid. Oh well, might as well look at this here. So here, uh, this is where it's attaching to the sternum, okay, of the sternocleidomastoid, and this is where it attaches to. Well, this is the platysma. Let me get this out of the way, and then this is where it attaches to the clavicle, okay. So sternocleido, which stands for the clavicle, and then if we follow this upwards, it goes and inserts itself to the mastoid process up over here. So sternocleidomastoid. So I'm going to get rid of this also. Got rid of that there. Much better. And I'm going to get rid of this also. I don't want to see this. I don't want to see that. Perfect. All right. Now we can see these muscles better exposed. So here's again another picture of that sternohyoid. Let me get rid of this. We already looked at that. Get rid of that. Okay. Now this is a sternothyroid. Okay. So look at the sternohyoid. Now this is a sternothyroid. So the sternothyroid, remember, this is lateral and deep to the sternohyoid, and it's gonna insert at the thyroid cartilage, and the origin is going to be the posterior surface of the manubrium of your sternum. So this is the origin over here, and it goes up here. If you follow this, it goes inserts at this thyroid cartilage. It's over here, and again, you can't see it because that's not shown over here, but it's going to be right over here, where the picture is, where the muscle ends. So that's your sternothyroid. So let me get this out of over here. There, get rid of that. Sternothyroid. I want to get rid of that. Now we have what do we have left? Um, the omohyoid. Okay. Now for the omohyoid, remember it's gonna insert at the hyoid bone, the lower border of the hyoid bone, and then its origin is going to be the surface of the superior surface of the scapula. I think did we already look at this? I thought we looked at this already. Uh, so yeah, I think we already looked at this. So we're going to go back over there. Let's look over here. So yeah, there you go. This omohyoid. So we already looked at this. So here it goes. So you can see it's attaching itself to the scapula over there. I'm gonna just get rid of this. All right, omohyoid. There we go. And the omohyoid. We looked at this already, so I'm gonna get rid of this. So remember, superior surface of the scapula is its origin. The hyoid bone, the lower border of the hyoid bone. That's its insertion, and it depresses and retracts uh, your hyoid bone. So let's get rid of this and uh, get rid of that. Why isn't this going away? There we go. Get rid of that. And what do we have left? Uh, we already looked at the digastric muscles. Let's see. How can I'm going to get rid of this mandible there. Again, this is showing you the thyrohyoid again. So did we talk about the thyrohyoid? So again, it attaches to the thyroid cartilage, and then here for the thyrohyoid, remember this depresses the hyoid bone, or it elevates the larynx if the hyoid is fixed. So thyrohyoid, I don't think we spoke about this. So the insertion is the hyoid bone, and yeah, can you see it here? It's hard to see. If you get rid of this, now you can see it a little bit better. Um, no, I think I got rid of it by mistake. I don't know how to bring it back up. Uh, oh, here, I brought everything back up now. Maybe I shouldn't play around with this. There's your thyrohyoid. So again, here's your it's gonna here. It attaches itself. It inserts over here at the hyoid bone, and then it goes down to this the thyroid cartilage. So it stops like right around here. This is where it's the origin is going to be right over here, and you can't see it because of the sternothyroid muscle over here. So what we have next is yeah, we looked at the sternothyroid already. Let's get this out of the way. And we looked at the digastric already also, so I'm going to get this out of the way. I don't want to see that. Now we need to see the mylohyoid and the geniohyoid. So let's try to look at these now. And so the mylohyoid, it's going to elevate the hyoid bone and the floor of the mouth. And it inserts at the hyoid bone at the medium raphe, and the origin is the medial surface of the mandible. So let's go and find this, guys. So mylohyoid, and it's right over here. How can I show you a better picture of it? I really can't. Alright, so here you go. You can kind of see a little bit better. So this is that medium raphe that you kind of see right over there. I don't know if I can, yeah. Come on, out of the way, out of the way. We'll get this out of the way. And that out of the way, that out of the way. And let's see. I think, let me hold it over here. And I'm just peeling away layer after layer to kind of expose this a little bit better. Uh, so let's get this out of the way and get this digastric out of the way. It's a pretty long muscle, by the way, the digastric. Um, get that out of the way. Genioglossus. Oh, again, I came back to that one. Yeah, I'm just gonna get rid of this. Get rid of that. Why are the teeth still interesting? Teeth stays. Okay, so here you can kind of see how this let's get rid of the digastric. Over here, let's look at this mylohyoid. So here you go, and you see the median raphe right over here, and you can see the hyoid bone over here. So remember, it's the mylohyoid. It's going to be inserting into the hyoid bone, and the origin is going to be the medial surface of your mandible. So there's a median surface of the mandible. It's hard to see over here, but it's going to be over here, and then there goes that median raphe that it's connecting to. That it's going to end up connecting it anteriorly. And so the other thing that we had was this the geniohyoid. And if you can see the geniohyoid over here, uh, let me. Here's that geniohyoid right over here. So it's you can see it's inserting to the hyoid bone, and there's a hyoid right over there. And then if I turn it around, you can see where the origin. It's the inner surface of this mandibular symphysis. So this is it for these 8 muscles that we talk about. I'm not going to go to the Netters 3D. I think this is enough. We saw what we needed to see with this website with the zygote body this time around. Now we're going to be looking at the muscles of the neck and vertebral column. So these muscles, they're involved in head movements and trunk extension. So the head is moved by muscles originating from the axial skeleton. The major head flexors are the sternocleidomastoid muscles. They receive some help from the suprahyoid and the infrahyoid muscles that we're going to be looking at. Um, Lateral head movements, now this includes rotating and tilting of the head. This results in the muscles on only one side of the neck contracts. These actions are affected by the sternocleidomastoids and a number of deeper neck muscles that we're going to be looking at as well. Head extension is aided by the trapezius muscles of the back, but the main extensors of the head are the splenius muscles, which run deep to the trapezius. Trunk extension is affected by the deep or intrinsic back muscles that are associated with the bony vertebral column. Now, these deep muscles of the back, they also maintain the normal curvatures of your spine, acting as postural muscles. Now, as you consider these back muscles, keep in mind that they're deep. The superficial back muscles that cover them are concerned primarily with the movements of the shoulder girdle and upper limbs. The largest of the deep back muscle groups is the erector spinae group. The deep back muscles, they extend or hyperextend the spine, but contraction of the muscle on only one side causes lateral bending or flexion of the spine. Now, this lateral flexion is automatically accommodated by some degree of rotation of the vertebral column. Now, during vertebral movements, the articular facets of the vertebrae, they glide over one another. Now let's start off by looking at these anterior lateral neck muscles. So the first one we're going to be looking at is this sternocleidomastoid, and we saw this muscle when we were looking at some of the other muscles earlier on. Um, and so as you can see, this is a two-headed muscle. It's located deep to the plasma, and it's got so here's the one head here, another head over here. Its insertion is going to be over here. It's a Masseter process, and the origin is going to be one's going to be on the medial aspect of your clavicle, and the other is on the manubrium. The primary action for the sternocleidomastoid is that it flexes and laterally rotates your head. So simultaneous contraction of both these muscles, it causes the neck to flex. So when you're laying down and when you're putting your head up to look at something, this is the muscle that you're using, your sternocleidomastoid. Now, when you're using only one muscle at a time, then it allows you to rotate your head laterally to your sides. So again, when you're sitting down and you want to see who's sitting next to you, and you turn your head, So when just one muscle is contracting, that's the motion that the sternocleidomastoid will produce. It's innervated by your accessory nerve, which is your cranial nerve 11, and branches of the cervical spinal nerves C2 and C3. So deep to the sternocleidomastoid, we're going to find the scalene muscles. So as you can see here, we have your anterior scalene, the middle scalene, and the posterior scalene. Now, as far as the origins go, the origin for these muscles are on the transverse processes of your cervical vertebrae. And then the insertion for the anterior and the middle scalene is going to be on your first costal, your first rib. And for the posterior scalene, the insertion is going to be, as you can see in this picture, it's on your second costal over here. It's innervated by the cervical spinal nerves. And its prime action is to elevate the first two ribs, which helps us in inspiration. It expands your rib cage, and that allows your lungs to fill up with more air. In addition to that, it flexes and it rotates your neck. Be sure to look at this video that's showing you the splenius capitis muscle, and this one here, the semispinalis capitis. Again, you can find them on the Pearson website or the DVD if it came with your book, or again, you can go ahead online and Google it. Then there's another video for the iliocostalis. And this one here is for the longissimus muscle. And then finally you have your spinalis muscles. Again, be sure you look at all these videos. It's going to help you tremendously. Look for it on Google, I'm sorry, on YouTube, or again, go to the Pearson website. That's the best thing to do. Now let's take a look at the splenius muscle. So the splenius muscle, it consists of a capitis portion and a cervicus portion. Now, the capitis portion is known as a bandage muscle because it covers and holds down the deeper neck muscles. When we look at the origin and the insertion, the origin for them is the ligamentum nuchae and the spinous process of vertebrae C7 and going all the way down to T6. Again, you can't see them in this picture that well. And its insertion, it's going to be the masseter process of your temporal bone, which you can see over here, for the capitis portion. And for the cervix portion, the insertion is going to be the transverse process of C2 through C4. So again, it's you can't really see it over here in this picture, but it's going to be up over here, up this way. We'll see if we're able to see this in the 3D atlas. The primary action is to extend or hyperextend the head. When the splenius muscles on one side are activated, the head is rotated and bent laterally towards the same side. And it's innervated by the cervical spinal nerves. And in this picture here, we've seen this before, but it's so in this cadaver we can see we've seen these other muscles. So now let's just look at this, revisit the sternocleidomastoid since we discussed it. So you can see this one head, it's attaching to the manubrium over here, and then the other head, it's going to be attaching to the clavicle, the medial aspect of your clavicle. The rector spinae, these are the prime movers of your back extension. Now each side, it consists of the iliocostalis, the longissimus, and the spinalis muscles. These muscles, they form the intermediate layer of the intrinsic back muscles. The erector spinae, they provide resistance that helps control actions of bending forward at the waist, and they act as powerful extensors to promote return to the erect position. The iliocostalis, this is the most lateral muscle group of your erector spinae muscle, and it extends from the pelvis all the way up to the neck. As you can see, it consists of three different parts. You have the iliocostalis lumbrum, then there's the iliocostalis thoracis, and then you have the iliocostalis cervicis. So you find these according to the neck, the thoracic, and the lumbar regions of the spine. They're all innervated by the dorsal rami of your spinal nerves. And let's start first, go to the iliocostalis cervicus. So the iliocostalis cervicus, its origin is going to be the angles of ribs 3 to rib 6. So here's 1, 2, so right over here, ribs 3 to rib 6. This is the origin, and it's going to insert at the transverse process of right over here, C4, 5, and 6, C4 through C6. This is where it's going to be inserting. Again, you can't see it because the longissimus capitis muscles, it's anterior to it. Now, as far as action goes, for the iliocostalis cervicus, bilaterally, it's going to extend and hyperextend your neck. and unilaterally it's going to flex your neck. Now, before we move forward, I want to clarify a point that the erector spinae, it consists of the iliocostalis, the longissimus, and the spinalis. However, each one of these is consists of a subset of muscle groups, so it's further divided. So, for example, the iliocostalis, it consists of the cervicus, the thoracis, and the lumborum. And then when you go to the longissimus, it consists of a thoracis, a cervicus, and a capitis part. And then the spinalis, it consists of a thoracis and a cervicus part. So keep that in mind as you as we continue to move forward. So uh, now let's just look at the iliocostalis thoracis. So the thoracis, the origin is going to be at the angle of ribs 7 through 12, and it's going to be medial to the insertion of the iliocostalis lumborum. Its insertion is going to be the angles of ribs 1 through 6, and in addition to that, the transverse process of C7, which is right over here. Going down to the iliocostalis lumborum, the origin is going to be the medial and lateral sacral crest and the medial iliac crest. Its insertion is going to be the angles of rib 6 or 7 through 12. Its action that it provides, it's bilateral. So bilaterally, when these muscles contract, you get extension of your lower vertebral column. Unilateral a contraction of these muscles will cause flexion of your lower vertebral column. I believe I forgot to mention the actions for the iliocostalis thoracis. So bilaterally, when these muscles contract, it's going to cause extension of the vertebral column, and unilaterally, when it contracts, it's going to cause for flexion. Now let's move on with we'll go with the longissimus. So we'll start off with the longissimus thoracis. So the origin for this muscle is going to be the transverse and spinous process of lumbar vertebrae, the sacrum and the iliac crest via the iliocostal lumborum tendon, and the lumbosacral aponeurosis. The insertion is going to be the transverse process of T1 through T12 and between the tubercles and angles of your ribs 9 and 10. As far as his actions go, uh, so when you have bilateral contraction, it's going to extend and hyperextend the vertebral column, and unilateral action is going to laterally flex the vertebral column to that same side. Again, as far as the nerves goes, I told you before, they're all the dorsal rami of your uh, the spinal nerves. Now, for the longissimus cervicus, the origin is going to be the transverse process from T1 through T5, and the insertion is going to be the transverse process of C2 through C6. As far as his actions go, so when you have bilateral contraction, it's going to extend and hyperextend the neck vertebrae, and for unilateral action, it's going to laterally flex the neck vertebrae to the same side. Again, for the nervous supply, it's the dorsal rami of your spinal nerves. For the longissimus capitis, the origin is going to be the transverse process of T1 through T5 and the articular process of C4 or C5 through C7. The insertion is going to be the posterior portion of the mastoid process of the temporal bone. Now, its actions, when it contracts bilaterally, is to extend and hyperextend the head. And unilaterally, it's going to laterally flex and rotate the head to the same side. Again, the nervous supply, it's the same, the dorsal rami of your spinal nerves. Now we're going to be moving on to the spinalis muscle. And the spinalis we're going to be looking at first is the spinalis thoracis. And the origin for this is going to be the lower ligamentum nuchae and the spinous process of C6 or C7, and or sometimes it could be T1 or T2, so it varies. Similarly, the insertion is going to vary as well, being the spinous process of the axis of sometimes C3 or C4. Action, again, bilaterally when the muscles contract, it extends and hyperextends your neck. Now we're going to be looking at the semispinalis muscles. Now these composite muscles, they form the deep layers of part of your intrinsic back muscles. And they extend from the thoracic region all the way to your head. And they're made up of three parts. So when you look over here, you can see it consists of a capitis, cervicus, and the thoracis. So the very first one we'll look at is the semispinalis capitis. Now the origin for this is the transverse process of C7 through T6 and the articular process of C4 through C6. Its insertion is going to be between the superior and inferior knuckle lines of your occipital bone. And for the action, so bilateral contraction, it causes your head and neck to extend and hyperextend. Unilateral action, it causes the rotation of the head and neck to the opposite side. Again, for the nervous supply, it's the dorsal rami of your spinal nerves. And now let's move on to the next one, which will be the semispinalis cervicus. So uh, its origin is going to be the transverse process of T1 through T6, and the insertion is going to be the spinous process of C2 through C5. Bilateral contraction is going to cause extension of the neck, and unilateral contraction is going to laterally flex the neck, and it's going to rotate the neck to the opposite side. And finally, for the semispinalis thoracis, the origin is going to be the transverse process of T6 through T10 or T12, and the insertion is going to be the spinous process of T1 through T4 and C6 through C7. Bilateral contraction is going to extend the neck and thoracic part of your back, and unilateral contraction is going to laterally flex the neck and the thoracic back, and it can also rotate the cervical neck and the thoracic part of your back to the opposite sides. Now let's look at the quadratus lumborum. This is the fleshy muscle forming part of the posterior abdominal wall, and its origin is the medial half of the posterior iliac crest and the iliolumbar ligament. Its insertion is going to be the transverse process of L1 through L4 and the medial half of the 12th rib. Bilateral contraction causes extension of the vertebral column, and it stabilizes the 12th rib while we breathe in. Unilaterally, it's going to laterally flex the vertebral column. Its nervous supply is the subcostal nerve, your thoracic T12, and the ventral rami of the lumbar spinal nerves L1 through L4. And in this illustration here, we can see the deepest muscles of the semispinalis. So over here, you can see this multifidus, and as you can see, the multifidus it inserts at the spinous process, and then it goes across and it inserts at the transverse process. And so this could be going from the vertebrae above it and going downwards, extending down to the vertebrae below, or it could go down several vertebrae below its insertion point. And this is one of the main major stabilizer muscles that we have of our back. And a lot of times when you do have lower back pain, it's usually between the cause is going to be this multifidus and the quadratus lumborum. Usually it's it's about a 50-50 chance that these are the muscles that are causing the problem. Now when we look over here, we have the intertransversaris muscles and the interspinalis muscles. So when you look at the term inter and inter, it means between, and spine, this means spine. So this is the muscles that we find between the spine, and then over here, this is the muscles that we find between the transverse process of the vertebrae. So with the interspinalis, again, notice that the muscles are found between the vertebrae that's directly above and below, and for the intertransversaris, it's going to be the transverse process of the vertebrae that are above and below. And then for the rotatoris, you'll notice that you have the origin at the transverse process, and the insertion also being on the spinous process. And I'm going to stop over here for this part for chapter 1. Now, I'm deciding not to use the 3D website at this point, just because it's going to end up taking too much time. However, as I did say earlier on in the previous lecture, I believe, that please be sure to go online and use those websites, either the Zygoid Body or the Netters 3D, and to start looking for these muscles and to identify them. This is how you're going to end up remembering them, and you're going to reinforce this by this hands-on experience. So please be sure to do that. If you have any questions, please email me at my address that you can find below. If you like the videos, give it a thumbs up. Please be sure to subscribe if you haven't subscribed already. Also, please be sure to follow me on my Facebook page. Thank you so much, and best of luck.